Good afternoon, good evening, everybody, and thank you for joining us in this webinar, one of our open webinars on innovating for the new normal, experiences from around the world. This continues a series that we've been doing now for quite some time on COVID-19 and dementia. I am Paola Barbarino, and I'm the Chief Executive Officer of Alzheimer's Disease International. And it is my pleasure today to introduce you to an incredible range of panelists from literally all over the world. We've tried to make sure that the experiences of our colleagues in the various continents of the ADI membership are reflected in the panel today. I imagine the slides, yes, are going to move, and the next slides, please, Annie. During this time of COVID-19, we have launched an emergency appeal, and we have asked many of you to make a donation, as we are a charity and we rely on your donations to make sure that everything we do is, as usual, free of charge at the point of entry and available to everybody. I'm pleased to say that a lot of people have responded positively to this appeal, and I would like to thank you all for having done that. I would like to invite you to make further donation if you can, because that really does help us. And I would like in particular to thank Biogen today for having supported specifically this series of webinars during our emergency appeal. Thank you. Next slide will tell you more about our speakers today. We have invited Jason van Genderen. For those of you who have followed our webinars, Jason is the person who has had the brilliant idea of creating a supermarket in his home during COVID-19, and he will tell us about that in a video that we will show you shortly. For the Asia Pacific region, we have the wonderful Maree McCabe from Dementia Australia. Thank you, Maree, for staying up with us so late at night. We really appreciate that. Emily Ong from Singapore, Rachel Ling, also from Singapore, and Huali Wang from China. Huali is currently hosting another webinar, and she will join us at the very end of this live webinar. From the African region, we will hear from Petra Dutoit from South Africa, and further speakers will include for the Americas region, Douglas Pace from the USA, and Paola Maeso from Uruguay. For the Eastern Mediterranean region, we'll have Füsun Kocaman from Turkey and Davic Krivec from Slovenia. For the European region, we will hear from Lorène Gilly from France and Anne de Boer from the Netherlands. And then I think we are going to hear from our wonderful Huali Wang, who, as you know, has been one of the people that has kickstarted this whole webinar series very much at the beginning back in early March. So I thank you all, and I invite you to listen to this very short video made by Jason about his experience. Please remember that if you want to ask any questions, you can ask questions in the questions and answer box. If you want just to chat with us and tell us from where you are, please use the chat box. So question and answer for the questions and chat box for the greetings. And remember that last time we had people coming in from 80 countries. So if you are from a particular country and want to let us know about that, we will record that. So please do let us know. And finally, remember, everything is very fast paced at the ADI webinar. So this will be 5 minutes only, and we will have question and answer at the end. Thank you very much. And now to the video of Jason. Thank you.
Hi, thank you so much for inviting me to join you in this beautiful forum today. I'm glad I could join you in some way, although it's pre-recorded, not live. I'll explain why in just a moment. So my name is Jason. I am a content creator living just north of Sydney in New South Wales, Australia. We've got a busy little hectic family ranging in age from a 1-year-old to a 5-year-old to a 15-year-old to an 18-year-old. And at the other end of the spectrum, my 87-year-old mother who lives with us and has Alzheimer's disease as well as vascular dementia. And that's really my linkage to you today, is a beautiful little thing that played out during home isolation here in Australia. We were discovering that my mother's routines had to change because we couldn't take her outdoors anymore. We couldn't let her enjoy little things such as her Tuesday shopping trip to the local supermarket. She couldn't enjoy going to the local club on a Thursday, or the morning visits to our local cafe to enjoy a coffee. And we discovered that taking those routines away from her really had a significant impact on not only her confidence, but her anxiety levels. And it was those behavioural sides of her that we were really worried about having a lasting impact on her. So we decided we want to do something to change that. Now, the reason I'm not joining you live today is because my mother unfortunately had a fall yesterday, so her care needs have increased. I need to be on hand when she goes to bed tonight, which is when this is going live here in Australia. So that's why I'm joining in a pre-recorded sense. But again, like I said, we were really adamant as a family that we wanted to try and do something during home isolation to create some innovative change. We thought we could actually set up a supermarket in our lounge room and let her enjoy the process of shopping, but in a home environment. And we made a little video about it. The whole family got involved, and I want to play a clip from that so you understand how that rolled out. Here we go.
Shopping at home?
Yeah, we've made a shopping centre at home, especially for you. We've got the supermarket at home. So as you can see, we had a lot of fun making that clip. It was a beautiful little exercise for us to do as a family. The look on my mother's face was priceless. She really enjoyed it. So we put it on Facebook, went to sleep as a family that night, thought nothing more of it, and woke the next morning to this video having gone viral, having gone nuts. And it was at that point that our lives pretty much changed, and we were doing media interviews with news networks all over the world. We converted the bedroom you see behind me into a mobile broadcasting studio. We were featured on shows such as Good Morning America and The Late Late Show with James Corden, amongst many, many others. And it was from all of that attention, all of that media interest, and from the thousands of messages that we were receiving, that we realized that we had a good opportunity here to create a lasting legacy and a lasting change in this space. So that first video attracted 15 million views within a matter of weeks, and we wanted to create more. So we did. And I'll bring up the next slide. This shows you a thumbnail of each of the other videos we created in this little story suite. And you can also see from the stats on those little videos there that our views ranged from 500,000 right through to 2 million, 10 million, 6 million. So there was a lot of interest ongoing in this space and in our little story of living with dementia. One of the great things for us was the interest by millennial channels. So we found social media sites such as Lad Bible and Unilad were some of our biggest sharers of content. And that was a huge surprise for us that they were interested in this. Within a matter of weeks, we were sitting at 37 million views across our content. And we also then parked all of these stories in our own little space. We created a Facebook page called Oma's Applesauce if you want to check out the stories. And we started working with organisations such as Dementia Australia here locally to help advocate for better storytelling around dementia. We're also working with a relatively new group that's been formed around promoting and creating understanding and awareness around childhood dementia. I'm doing everything I can to fight ageism and create positive stories and positive role model messages around the value of every age member in a family unit, as you can see in our stories. And we're also turning all of this into a much larger, longer format documentary, which I'm really, really super excited about. From here, I'm just really looking forward to spreading the stories, to creating more stories, and to create more hope for families around the world living and caring for someone with dementia. That's really the space that I'm excited about spending more time in, and this is all part of that. So again, thank you for having me as part of this evening, and I'm looking forward to hearing the other speakers tonight. Peace and love.
And peace and love to you, Jason. Thank you for this great video that I'm sure has put a smile on our face as we start this very difficult webinar otherwise. But also I have to say it has inspired us at ADI, because we had no idea that Lad Bible or Interlad could be some targets to work on for World Alzheimer's Month. And I think this inspires all of us that there is a lot more interest in our topics that we think, and we should find ways of engaging different channels for that. Now, I'd like to invite Maree McCabe, who has very patiently been on the line, who is the CEO of Dementia Australia, a member of ADI Asia Pacific Regional Committee and the chair of our nomination committee. Maree, I can't start saying how many things they've been doing in Australia, what an example it has been for all of us in this time. Maree, over to you, the floor is yours. And you may need to unmute yourself.
Thank you, Paola. Thank you so much. Hello, everybody. It's fabulous to be here. Thank you for joining us from around the world. For the Australians that are joining us today, I acknowledge the traditional owners of the land on which we're meeting and pay respects to their elders past, present, and to our shared futures. Now, you know that certainly COVID-19 has had a significant impact on people living with dementia globally. And Dementia Australia has certainly had to pivot in terms of the way that we operate. And like many countries around the world, like everybody, we've implemented our pandemic management plan. We've followed the situation closely, implemented all of the initiatives and ideas from government and health authorities across the country. And in some instances, we've actually ensured additional safeguards. We started working from home very early on, and our staff have adapted extraordinarily well. They have been amazing, and we are now running a lot of our programs for people living with dementia online. Now, where we need to do face-to-face contact, we do, and one of the important areas in relation to that is where carers need support. So it may be that carers are going for dialysis, they may be having chemotherapy, and so on those occasions we do in-home respite. Our National Dementia Helpline has certainly continued to operate as usual, and our website and social media sites we update regularly with information about programs and services, any changes, and any information that we're getting that we think will make a difference, particularly to the aged care community, to people living with dementia, and to families and carers. And we've had an amazing uptake from people, in fact, far greater than we expected. People using our online services. We had a 93-year-old carer who was so delighted that she could use Zoom, and the thing that she was most inspired by was that she's now found a way that she can keep her book club going. So the adaptation of people has truly been extraordinary. Now, some of our activities and programs have had to be postponed, and they're the ones where there have been large gatherings of people where we've been unable to implement social distancing. And at the very beginning, COVID-19 started at the very beginning of our fundraising part of the year where we do our memory walk and jogs. Now, we had to cancel all of our fundraising and fee-for-service events during that time. And the team successfully adapted those to some online activities, and that's enabled people to participate virtually in our memory walk and jog and continue to raise much needed funds and, to mitigate the financial impact that we've all sustained. In response to COVID-19, we have been particularly focused on supporting people working in residential care and specifically working with people living with dementia. And we've been looking for ways to how do we get out short, sharp snippets of information that will deal with some of the challenges that they face immediately. And what we did, and I really acknowledge Dr. Huali Wang for this, is that we developed tip sheets from Huali's the YouTube video that she did. We've had over 7,000 downloads. Our Dementia Australia Advisory Committee, they developed Zoom tip sheets to help people living with dementia to connect. And one of the other things we did is we developed short videos for staff on the front line, and we gave them tips about how to deal with challenging behaviours, and we encourage people to keep working on making a difference in, if something doesn't work the first time, don't stop. It may not work the first time, but there will be other things that will make a difference. And so we've explained what people can do in relation to that as alternatives, of course, to medication and physical restraint. And we've been absolutely overwhelmed where we've had about well over 20,000 views of those videos. So they've been a huge success. regular meetings with the health sector, the Department of Health and Minister for Aged Care and Senior Australians. And I have to say, we've been incredibly blessed with the Minister. He has been at every meeting, and what it's done is it really has united the aged care industry, the peak bodies, the consumer peaks, the approved providers, to really put our best foot forward to make a difference, and a profound and lasting difference to people in residential care, and particularly to people living with dementia. We also launched a new national campaign urging all Australians to take a pledge to keep the world open for people living with dementia, not just during COVID-19, but every day. And it ran across television and digitally. We invited members of the public to understand more about dementia and to help end discrimination. And that's been extraordinarily successful. And there's certainly now, we all now have had the experience of what it's like to be isolated. And for people living with dementia, that's something that each and every day that they have to deal with. Certainly, one of the greatest things about this has been the partnerships that we've developed, and it's been extraordinarily inspiring and an honour to be able to work with industry leaders, with our government, and above all with people living with dementia, focusing on innovative strategies now and into the future to make a profound and lasting difference for the lives of people living with dementia and those impacted by it. So thank you all. I'm very happy to take any questions, Paola, at your convenience, and thank you so much for your time today.
Thank you so much, Maree. Thank you. And thank you for pointing out, I think, two really important things, which shows just how advanced you are over in Australia. The level of adaptation that there has been, you know, the story of the lady that even managed to run her own book club. Some of the questions we've been getting in advance of this webinar have been about, now that the civil society has been so hardly hit by the issues around COVID and the loss of income, how can we guarantee that those people with dementia that can live a very independent life continue to do so in absence of resources? And I think we'll tackle that question at the end of the webinar. But also there was an issue around collaboration. You are just so much more advanced than anyone else. I mean, you really do take the ideas and manage to integrate them in your thinking and planning, and then, you know, really bring them on stream, which I think has been an inspiration to all of us. And it's no surprise that Jason come from Australia, I think. Now, we will take questions, but they will be at the end of the webinar. So I know that you may have to leave us. If there are specific questions that will come for you, as ever in our webinars, and I am also addressing those that are watching us, I've seen here over 40 countries watching us. So thank you very much, everybody, for being with us sometime very early in the morning or very late at night. We will be addressing them to all panelists so that a dialogue can be open with those that have questions. I will now, however, move to the next intervention. Now, this is a very important intervention coming from Emily Ong, who lives with dementia in Singapore. She's an advocate for young onset dementia and a graduate from Alzheimer Disease Association of Singapore, Voices for Hopes program, a very important program that has been running in Singapore now for quite some time. Emily, the floor is yours. Thank you for being with us today.
Thank you, Paola, for the invite, and good evening from Singapore. Well, next slide, please. While the full destructive potential of the COVID-19 is yet to reveal, the lockdown measures to contain the coronavirus spread are disrupting the status quo of how we work and live and socialize and provide the community support. As a person living with dementia, these disruptions and chaos caused much anxiety and stress and added confusion to my life. However, with my family's strong support and leveraging on the technology, have enabled me to adjust and adapt to the changes and the disruption to the routine quite well. I never shopped online before, but since the start of January this year, my family has started preparing and teaching me how to shop on Lazada to do the online grocery shopping. It's a way for me to not to maintain my independence and also continue my the things that I love to do. I've improved so much over the months from not knowing how to operate the app to now able to browse through the categories and then add to the cart, select the date of delivery, click the payment with minimal help from my families. Well, I do miss going to the market, but I learned to like the peacefulness and the ease of doing the grocery online. It will definitely stay as a new norm of doing things for me. And I also have, through DAI, I have learned to be very familiar with Zoom webinar, and that has helped me a lot in continue to do my advocacy work. And just recently, I delivered two webinar presentations with the collaboration with the National Library Board of Singapore. And social network and a social platform like Facebook has become even more crucial part for me to stay connected with friends from all over the world, especially during this time whereby our local gathering support is not viable. Next slide, please, Amy. Now, for the ADS Singapore Voices for Hope program is aimed to prepare and develop the person living with dementia and their care partners to become advocates for the dementia community. But due to the disruptions from the staying-in measures, the program was extended to 15 weeks instead of the usual 8 weeks. And we heard a lot of the challenges from people living with dementia, as myself also experienced. And so we try to bring the Voices for Hope program online, but it was not an easy task because our activities are primarily designed for in-person interactions within a physical setting. So, and moreover, because of our culture, having discussion and sharing on online platform is not a thing. It's rather new. So we have to find ways to how to get the people to feel comfortable to go online. Yeah. So next slide, please. So and when we are doing on in-person and within a physical setting, we normally have a separate rooms for the care partners to have a discussion from the and while the person living with dementia have another separate room. And we found that that is missing in our online support Voices for Hope program. So then we come out with the idea of have an additional time, a separate day for the care partners to come together. So then we found that we not only have done it, but we also have our very first online Voices for Hope graduation on the 9th of July, which was marvelous done. So in a way, I would like to say the COVID-19 pandemic has challenged us to rethink of the alternative way of doing advocacy and providing support. Thank you.
Emily, I think you've finished. My video and audio for a moment have just disappeared.
I see.
Thanks for your contribution. I think one of the things that you have mentioned, which is quite generous and wonderful of you to mention, particularly coming from you, is this discomfort in the care partners experience, which we have now experienced pretty much all over the world. The new normal obviously does really not think about what's going to happen to care partners yet. We are receiving quite a lot of distress communications every week from people that find it very hard to cope in the new situation, which seems to be dragging on forever. And once again, some of the questions we have received are around social services. Will they ever resume? Will we ever be able to sort of take advantage of those opportunities? But you have also shown us how we can do a lot by helping ourselves and trying to overcome those difficulties in other ways. Now, I can see that there is quite a lot of interaction on the chat. The number of nations present is increasing. Can I remind all of the people who are listening to this webinar, please, if you have a question, type it in the Q&A box, because this is where we are going to pick up question and answer at the end of the webinar. And now I would like to introduce you to our next speaker, who is Rachel Lim, who is a program executive in the community enabling team at ADA Singapore. Rachel will do a presentation that is complementary to the one of Emily that you have just had. Rachel, please, the floor is yours.
Hi everyone. Thank you for having me here today to share about efforts during this pandemic. So from Alzheimer's Disease Association in Singapore, as we adapt to the new norm, a lot of our programs at the family level, such as the Family of Wisdom, are required to cease when Singapore's circuit breaker measures were announced. And since then, our Family of Wisdom program had started doing live video calls via Zoom, which allowed our care staff to continue the interaction with our clients. And these activities are done virtually and can also be personalized to the client's needs and their interests, like, for example, music, arts, and as well pets therapy. And we have Memories Cafe, another program of ours. We've piloted a virtual Memories Cafe live stream via YouTube, and we've also included some elements such as team calling during a live stream and making conversations via the chat or text messages. So all of these efforts were practiced to increase the sense of life for the viewers, to remind them that this is not a television program that they are watching. And our clients and families, as well as the general public, can tune in for sing-along sessions, as well as music movements activities with our artists every Saturday. Each of these live stream is also recorded and then re-uploaded onto our ADA's YouTube channel, which has since attracted at least 350 views to 600 views. And next slide, please. Also on the family level, we have been supporting our caregivers through caregiver support group meetings, which is done via Zoom. And through these sessions, we are able to identify families that are experiencing severe challenges during this pandemic. And we can provide support such as home visits, which is on a case-by-case basis. Since May, we have also had our training program starting to implement more virtual classroom formats to conduct our professional and family caregiver training program. At the end of July, ADA will also be launching a new webinar series. It's called the Caregiver Essentials for Family Caregivers. So this webinar is conducted to help our caregivers cope with the new challenges in caregiving in the midst of COVID-19. We've featured topics which includes innovative ways in caregiving, as well as how they can respond to the changed behaviors in the persons living with dementia. Next slide, please. Now, on the national level, ADA in Singapore has also launched a new initiative. It's called the SPOC19. So this is an initiative to support caregivers and persons living with dementia who may unknowingly violate the COVID-19 precautionary measures, such as safe distancing as well as mandatory mask wearing wherever they are in public. And previously, we have caregivers and social service agencies that raised their concerns regarding the safety of those living with dementia and their inability to comply with safety measures. So therefore, ADA collaborated with various ministries that are overseeing the health, environment, and the police to ensure that the maximum impact for SPOC19. And the collaboration includes a press release as well as providing a briefing guide to all safe distancing officials, and these are government officials. These briefings are done to brief them on how they can communicate with person living with dementia, as well as what they can do to support the person living with dementia. And in this situation, that they can utilize the ADA's helpline to assist them when they are talking to persons living with dementia. So through SPOC19, ADA has also introduced a new identifier, and which is the memo as shown in the slides. So this memo is to complement the existing identifiers such as a safe written card. So this memo is a quicker way to support families, including those that have not been diagnosed with dementia yet. So to share some key challenges when ADA was introducing the SPOC19, we do have a group of persons living with dementia who lives alone, and they do not have mobile phones or email address. So these are the group that are unable to receive this ADA memo. So which means, you know, when they are out in the public, they have accidentally violated the regulations, they may not be able to explain themselves. So what we did is that, you know, we still kept them in our registered list, where the government officials could still check in with ADA in cases where, you know, they've met persons who live with dementia. And the second challenge that we've also met is that because the memo is requested online without a formal diagnosis, we run the risk of potential abuses where they could just apply for the memo without having dementia. So, you know, they just want to have the memo so that they can be avoid the penalized rules, regulations that we have. So what we did is that we conduct verification screenings with all of the registered, everyone who registered. And then, you know, we ask them some key questions, such as describing their symptoms in detail, as well as getting their names, address, and mobile numbers. So this is what we do to, you know, deter any possible abuses of the memo. So moving forward, ADA's direction is definitely to innovate, as well as to continue to leverage on our technology so that we can support more persons living with dementia, as well as their family. And, you know, together we can go on to this journey of adapting to the new norm. Thank you. Thank you for today.
Wow, Rachel, thank you so much. You've just raised something that is completely new, that has not really been raised yet in one of the ADA webinar. And I think, given we got Maree online with us for another few minutes, I'd like to just quickly interrupt the way that we are flowing here and ask Maree, this idea of the memo, and also interestingly, this idea that somebody could abuse it by purporting to be something that they are not, which of course is something we haven't really talked or considered yet, but could become a problem. Have you encountered anything like that in Australia? And have you done anything like the memo?
I think the memo is a great idea, Paola. And one of the challenges, of course, is that when people are vulnerable because of age or cognitive impairment, they are more open to abuse. And it has been certainly something that we've been monitoring since COVID has started, because of issues such as elder abuse that are more likely when people are confined, they're unable to get out and do the things that they normally do and to have some time away. But I think that, you know, there have certainly been scams that have been going on that we've been aware of. And when we're aware of those scams, we absolutely let clients know if it's likely to impact them and if we are aware of them. But I think that, you know, I think the idea of the memo is a really great idea, and protecting people is always an issue, and best, I think, to put that to one of our dementia advisory groups and ask for their feedback about how best to deal with that.
Thank you so much, Maree. Emily, I think you have really fed us a lot of very interesting ideas with your presentation, as we always would expect from ADA. You're always so quick into innovation. I am incredibly impressed by the wealth of your information. Can I remind everybody on the webinar, please, that we are going to have a link available very soon, so you'll be able to revisit the slides and presentation at your own leisure and ask more questions. Maree, Emily, please, Rachel, I've seen that there's a lot of praise also on the chat line for your intervention so far. I thank you very much, and I conclude here the experience of Asia Pacific. I can tell you from Asia, we had an audience from India, Japan, Australia, Nepal, Brunei, Malaysia, Singapore. If I haven't mentioned anyone, please make yourself known through the chat line. Now, can I introduce the segment on Africa? We have a video from Petra Dutoit from South Africa. I can see today from Africa, we have representatives from Zimbabwe, Nigeria, Senegal, South Africa, Mauritius, Brunei, Burundi. If there is anyone else from Africa, please make yourself known. Thank you very much. And Petra, the floor is virtually yours.
Okay. Good morning, good day, everyone. Thank you, ADI and Paola and your staff your team for the opportunity to share the South African story with you. Next slide, please. When COVID-19 became a reality in the world, we knew that this would be more than to stay safe, to stay alive, and to stay healthy. We knew that a pandemic like this would have a vast impact on people living with dementia and their families. So we had to put some measures into place to still be available to people who need our services during this challenging times. So first of all, we decentralized our offices, our regional offices, to home offices, and we also tried to keep our telephone lines and national helplines alive so that people can reach us. We are fortunate to have a national office in Johannesburg and regional offices throughout the country, so we have a national footprint in South Africa, which make it good for people to get hold of us. Then we started by sending out operational guidelines so that our personnel know what they can do, because that was according to the national rules by our government. So we sent out these guidelines so that people know that they can still render services, especially during crisis situations. We prepared an essential services document because vulnerable and frail people, like people living with dementia, fall into the essential services group, and we need to be able to still render that in services in case of an emergency. Our main aim was to keep into contact with our service users. So we did that by means of WhatsApp, telephone calls, emails, and text messages. I know of some of the support groups who changed to WhatsApp groups. Other support group leaders use Zoom or Skype meetings to stay into contact with support group members to render our services and to be there for them. Next slide, please. One of our regional managers prepared an article on COVID-19 for our website, and we updated that article recently to share the most recent news and updates regarding the impact of the pandemic on people living with dementia. We also do regular posts on Facebook and Twitter, and we try to empower our personnel through webinars and Zoom training sessions to be able to render services under this new normal. We share Zoom links and webinars, info with regard to webinars amongst each other to equip ourselves with knowledge. As we have a little bit more time on our hands to do some research, we are updating our current training and awareness material and also translating the material into indigenous languages to be there and so that the info is up to date and user-friendly. We also reached out to the national media, the television, national newspapers, as well as local newspapers, because we want to be visible. We want to be in people's faces. They must know that we are there and that we are aware of the impact of COVID-19 on people living with dementia. Next slide, please. We are fortunate to have a very active and professional board of management at Alzheimer South Africa, and we knew that we have to change our operations. Our service rendering, fundraising, and income generating initiatives were challenged with the COVID-19 situation, and we have to adapt our standard operating procedures for service rendering and income generation. And with the support of our board, we put proper business and financial management activities into place to still steer this boat through the stormy waters. We applied for relief funds that became available in South Africa to help us to survive and stay sustainable. For us, it was important to stay relevant, creative, and innovative in this new normal. Next slide, please. I want to conclude by this quote: nothing changes if nothing changes. We at Alzheimer South Africa is here. We are accepting the challenge of change to the benefit of people living with dementia and their loved ones in South Africa. Thank you.
Thank you so much, Petra. Even from far away in South Africa, you managed to give us a really big pearl of wisdom with nothing changes if nothing changes. This is going to become one of my favorite phrases from now on. I have been delighted to hear Petra's intervention. We all know that Africa has a particular issue in the outreach to people that are not in urban areas, but crucially in the outreach for different languages, because there are just so many. And it's great she's mentioned that and what are they doing. Now, I would like to invite all of those that are attending from Africa, but also from further away, to pose some questions to Petra through the question and answer box. Even if Petra is not here, we may pass them to her, or somebody else may be able to take them at the end of the panel. I would like to acknowledge that Madagascar also is present. They were not in the original list that I read. Now, I'd like us to move to the North American region, in fact, the Americas region more generally, and introduce you to Douglas Pace, who is the Director of Mission Partnerships at the Alzheimer's Association, ADI member in the US, the co-lead of Dementia Care Practice Recommendation, and the lead of Dementia Care Provider Roundtable, the project ECO on long-term care. Douglas, the floor is yours. We are delighted to have you with us. America has been showing us quite a lot of very interesting innovation and ideas throughout COVID-19, and we all acknowledge the terrible time that all of you guys are having over there. A big hug from all of us from all over the world. Douglas.
Well, hello, everyone, and greetings from Washington, D.C., and thank you for the opportunity to be with you today. Next slide. So in 2018, the Alzheimer's Association released our updated dementia care practice recommendations in a special supplement of the gerontologist. I, along with my colleague, Dr. Sam Fazio, led a group of 27 researchers in the development of 56 peer-reviewed, evidence-based recommendations grounded in the foundation of person-centered care. The recommendations are for care professionals working in long-term and community-based care settings. And in addition to person-centered care, the topic areas are detection and diagnosis, assessment and care planning, medical management, information, education and support, dementia-related behaviors, activities of daily living, workforce, supportive and therapeutic environments, and transitions and coordination of services. Next slide, please. So when COVID-19 hit the US, we used the foundation of the dementia care practice recommendations to develop emergency preparedness guidelines. We know that a large percentage of all residents in nursing homes and assisted living communities have dementia, and residents with dementia have unique needs, and understanding what contributes to their well-being is extremely important, both from a clinical and a non-clinical perspective. So during emergency situations like the COVID-19 pandemic, there will most likely be staff shortages, and non-clinical staff will be involved with resident care and support, and many of them will not be trained on how to provide quality dementia care. So it's important for us to remind all staff that persons with dementia thrive best with a consistent routine. And even in emergency situations, it's important to practice person-centered care and use every interaction as an opportunity for engagement. So these guidelines provide information like the importance of hand washing, not only for staff, but also of residents. A few years ago, I was part of the faculty of a series of nationwide infection control workshops. And one of the biggest ahas from that experience was that uniformly staff engaged in good hand washing protocols, but they didn't have strong protocols to ensure that residents' hands were washed regularly. We also know that social isolation is currently a huge issue, and it's important for residents to have opportunities to connect with friends and family. And continued isolation can foster an environment that can increase dementia-related behaviors. Also, persons with dementia may not have the ability to recognize hunger or thirst, and those in the late stages have special challenges and will need trained or licensed staff to assist with eating. And maintaining strength and mobility and the ability to exercise while providing a safe environment is also important. These guidelines are supported by 36 aging organizations and associations across the US. And the link on the slide will take you to the web pages with more information. Next slide, please. So as a way to help disseminate the information in the guidelines, we've been hosting Project ECHO COVID-19 focused sessions with nursing homes and assisted living communities across the US. So Project ECHO is a video conference learning platform that combines mentoring with case-based presentations. And one of the major findings of the ECHO series is that the weeks of social isolation of residents in assisted living and nursing homes is resulting in both physical and mental decline. Additionally, I want to share another webpage that highlights state and federal policy guidelines that we just released that emphasize 4 important activities that are crucial to the well-being of everyone. Number 1, testing. Every community must have on-site capability to test staff, residents, and visitors. Number 2, reporting. All cases need to be reported immediately and accurately. Number 3, surge activation. As hotspots occur, they need to be dealt with urgently and effectively. And number 4, support. All nursing homes and assisted living communities must have full access to PPE, testing equipment, training, and external support to keep them COVID-19 free. Also remembering that we have increased knowledge is a cornerstone of well-being, and the association continues to encourage everyone to contact our 24/7 helpline that's available 7 days a week, 365 days a year for the general public, as well as for those persons working with dementia. And finally, we know that it can be difficult to provide care in a changing environment, but we continue to stress that providing a consistent routine, putting the person before the task, and using every interaction as an opportunity for engagement can improve the quality of care and the quality of life for those living with dementia. Thank you.
Thank you so much, Douglas. This was very interesting and also so well organized as a presentation. I think it will have clarified a lot in terms of focus for many of us. I think I also thank you for reminding everybody our movement is about person-centered activities. To put the person before the task is the most important thing that we can keep pressing on. So thank you so much for your presentation and its clarity. I now invite Paola Maeso from Uruguay. Paola is also not only the president of the Asociación Uruguaya de Alzheimer y Similares, but she is also on the board of Alzheimer's Disease International. Paola, please, the floor is yours on the Uruguay experience. You may need to unmute yourself.
Thank you, Paola. Good morning and good afternoon, everyone. On behalf of our association, I would like to give much thanks for the invitation to participate in this webinar. Also, I want to say that we are members of Alzheimer Iberoamerica too. That's the trademark in this point. So, Uruguay also suffered an impact that began in the March due to COVID-19. Our situation is not a grave since we have a few active cases and we expect to return to normality. We didn't have compulsory isolation. It was urgent by the government and assessed by the whole population. And all aulas will not be the exception to this. We decided to close the door of our institution, thinking that it would be for a couple of weeks until we realized that all this work takes more time. Then the following questions arose. What do we do now? And how do we do it? The answers to these questions are the content of my presentation today to share with you, which will have 3 points to highlight. Number 1, the creative that was implemented to continue being able to fulfill the object of our association. Number 2, networking about what other associations did and how it enriched us all and strengthened us. And number 3, decision making to subsidize economically. This is a very important point. Firstly, our board of directors analyzed the situation of how we had been operating and what were the needs of the population with whom we worked. We went from face-to-face to look down, and this limited the realization of activities and being closer to the population with which we work. We decided to operate in home office format, and all Auda's members actively participate. It's worth highlighting that we have implemented several activities with each individual. Firstly, our center day, we are 21 people attending daily to carry out various neurocognitive activities, and it's an area of socialization for them. They found both without displays, like they related with the fact of having them in their hours during in his house. To support the user of the day center and their families, we put together a daily task with slogans to show that they can completely at home. They were guidance and were sent by email and by WhatsApp when they did not have email. That is a reality. The telephone contact and video calls to the user by the techniques that are with them day by day in their center made it possible to be closer. Secondly, the individual orientation that are carried out with family members once the diagnostic is obtained, where they are given support and guidance to cope with the disease that affects the entire family. The orientation began to be carried out by the technological platform, especially by Zoom. Also, we must say that it was not the same without doubt. Finally, the workshop for family members and caregivers were previously held once a month in person. We are currently able to engage every 15 days by the use of Zoom with the support of the Uruguayan Council of Social Welfare, of which Audas is a member. The work in red and the link with other organizations allowed use continue with this space. Next slide, please. Sorry, okay, perfect, thank you. It's the work, nothing direct work in the regions. Each association appealed to the resilience that characterizes them, exposed to social, logistical, political, cultural, and economic threats. They tried to adapt effectively. Activities were carried out throughout the regions, which were shared to give example to other institutions and to invite population from all over the Americas to participate in the various activities. Borders were transcended and family support group with the participation of people from different countries was totally enriching. Talking through various technologic media, social network, use the radio station, collaboration and teamwork have been the creative and innovative experience of this entire experience. Next slide, please. Thank you. Finally, a point that I want to consider that important to comment on is how do we subsist economically? The income of our association is basically 1. Members, 2. Day center use fee, 3. Annual state match, 4. Contribution and donation. All funding was reduced at this time, which led to decision-making based on the fixed expense and income of people who today had other priorities outside of our association. Fortunately, we have no pay to rent electricity or water expense. all of which is an advantage, and we are always grateful to the Commission for the Fight Against Tuberculosis that was supported us in this regard since beginning of our activities. This support is very important for us and more in this time. Also, we don't have other fixed expenses: employer salary, phone service, internet, health insurance, employer social security, dues for being member of organization, among others. Decisions were made opting for the staff to send to unemployment insurance. Those who could not access the insurance because they had other jobs and had to be removed from the association for the moment. It was a very rude decision. But we had specially managed of maintain the technical and administrative team that continue to work to reach users and relatives. In many cases, a reduction in working hours and a corresponding salary reduction were made. The board of directors set up tasks to send to members, which participate in coordinate workshops for family members and caregiving today. The decision was made to accompany users and their families without compulsory charging the monthly fee, leaving the discretion unavailable of each decision for each. The decision and the way of communicating it together that half of the user continue to pay the monthly fee, some while another apart. The workshops for family members and caregivers were open, free or changed. We brought many family members closer, and we met. They can partners paying their fees, and they place it. The donations were not in for of money, but in collaboration, which is always useful as well. In short, teamwork, adaptation to change in order to continue meeting objectives, and try to make a strategic alliance with organization and another association that also used to be. Grow and survive in a period of crisis is a lesson to be learned by all. Thank you very much.
Thank you, Paola, and thank you for raising the very complex issue in South America, especially, which is a very great concern for all of the ADI family. A lot of the associations are having terrible time with COVID, and they are losing a lot of support. So I think the fundraising element there is of great concern to all of us. So thank you very much. We are running late, so I'm going to move quickly and swiftly to the Eastern Mediterranean region. And especially to Füsun Kocaman. Thank you very much from Turkey. It's the first time that Turkey is speaking at one of our open webinars. Füsun and David, I will have to ask you to keep to your 5 minutes, because otherwise we're going to get terribly over time and won't be time for questions which are coming in. Thank you so much.
Okay, thank you. Hello, everyone. Thank you for your time. I think I had a previous slide on this one, but no problem. And okay, there's one missing, no problem. I'm the executive director of the Turkish Alzheimer Association, which was established in 1997, that is serving almost 23 years already. And the organization was established by the medical doctors and caregivers. And the main aim has always been raising awareness in the public and also supporting the caregivers. So I can say that the main target group of the association is caregivers rather than the patients themselves. The association functions with 15 branches in 14 cities in the country. And also we have a very tight collaboration with the German Alzheimer Gesellschaft, because there are almost 5 million Turks living in Germany who need support in their native language. So we're trying to reach all the caregivers who need our help. As you can see on this slide, the association supports the caregivers by both giving training for the awareness purposes about the disease and its care, how to take care of the person with Alzheimer's, and also helping their load by easing their life, trying to ease their lives with regular training seminars or regular group psychotherapy sessions and home care and Alzheimer nursing homes. On this slide, you see 3 of our services only, which are all free of charge. The nursing homes where the Alzheimer patients can live day and night. They need to pay a minimum fee for the services they get there. This is why I haven't put that on this slide, but there are 2 very well functioning nursing homes as well. If we could skip to the next slide, please. In the daycare centers that we support very much, and there are 5 of them already functioning in the country, 2 of them are in Istanbul. The daycare centers, we have a regular schedule where we always have something, some activity on every Wednesday. The main activities actually are both mental and psychomotor activities, so is physical exercises, art therapy, counseling, some excursions together with the people with dementia and their caregivers. And these are always scheduled and announced previously at the beginning of the year. Always we have a calendar for each activity, and all caregivers and the people who participate in the daycare center activities know very well that first Wednesday every month there is a seminar, and a medical doctor or a nurse comes to the daycare center to give information about the disease to the caregivers and how to take care, trying to teach them how to take care of their loved ones. Second and fourth Wednesdays are entertainment Wednesdays. It's called Tea Party, and both people with dementia and their family members, and also staff, professionals, formal or informal caregivers, participate in those parties where we have live music and some tea and cookies and pies, of course, which is to enjoy the time. On the third Wednesdays, we have psychological group therapy. We always have either a psychiatrist or a psychotherapy expert to attend the group therapy session, which normally lasts around 2 hours. So this schedule has been continuing ever since the organization has been established. But with the pandemic, of course, we had to stop all the functions. We had to lock down the daycare centers, and we had to, as all the other associations or societies do, we could help our caregivers or patients from using digital media like telephone, social media, Twitter, Instagram, Facebook, and web page also. We published many information about both the pandemic and some home entertainment activities. But then we found out that this wasn't enough. The patients who were used to being in a daycare center and enjoying our activities were having a very hard time. And so we decided to perform these tea parties digitally on Zoom. So to make it short, I have prepared a video to demonstrate the parties that we are having. Also, the digital grandchild project that we have started. If necessary, I can answer questions later on. If we could please watch the video, not to use too much time.
Thank you, Füsun. I think it's loading now. Not sure if we
It's
have
a 1 minute video.
online. It won't play.
Yeah,
So the
yeah, it's okay.
Unfortunately, it's coming, yeah.
Thank you for your time. I think I'm running out of my time, so I will just say one last sentence about the digital grandchild. The young people are assigned to an old person with dementia, Alzheimer, or healthy elderly, and they call them regularly with video calls and chat with them and try to keep them communicative and also tied to life. Thank you very much for your time.
Thank you very much, Füsun. Your lovely video reminds us of the digital gym that DY Suharia did for us a couple of webinars ago. It's such a lovely thing to see. And thank you for the idea of the digital grandchildren. I've seen something similar, but not quite named like that. So that's a very simple way to name it. We really love that. Thanks, Füsun. I'll run now to David Krivec from Slovenia. Slovenia has always been one of the most innovative countries in Europe and one of the first to have a plan. David, the floor is yours.
Thank you, Paola. Hello to everyone from Spominčica, Alzheimer, Slovenia. Yes, like all of you, also in Slovenia, we had quite a hard situation from March till the end of May. Now things are much better. We are returning in a way to normal, but we still have infections. Fortunately, in the last 2 months, we didn't have any deaths in the homes for elderly persons. So during the first part of COVID situation, we performed a survey with people with dementia and their relatives about their needs, their problems, about the lack of services during the lockdown. And the most important finding that people were missing was the lack of social interaction, lack to information and tips and advices for daily challenges. If we could add to this, they also lacked access to specialists, doctors, for their advice and treatment. So we responded immediately. We strengthened our telephone counseling involving healthcare professionals. That they are giving free counsel to all our users 2 times per week. We are also providing online tips for carers and persons with dementia, how to structure their day, what activities to perform, some cognitive serious games. And we publish this regularly on our website and on our Facebook. And monthly, we have more than 15,000 visits to these websites of persons reaching for the contents. Then, next slide, please. Yes. Then we have also realized the importance that we proceed to involve end users in our public activities. But to do this, we have provided for all necessary health protection measures. So we have engaged our dementia-friendly spots network. These are more than 200 different organizations providing information all over Slovenia to give support to persons with dementia and especially to their relatives who are seeking information. And we have also started with visual arts workshops in collaboration with National Gallery of Slovenia and with Alzheimer cafes. So we are performing live workshops and live cafes with all health protection measures. So with physical distance, and if there are more than 30 people present, they must wear masks. But to provide contents also for those who cannot join to our activities, we have started also with online Alzheimer cafes. We have so far recorded 4 Alzheimer cafes, and we have opened also online support group for family carers that were until now working face-to-face. Next slide, please. And there is another activity we are taking part since the beginning of summer. This is, we have joined the network of library under the treetops. This is an initiative organized by another association named Divja Misel. And in the park outside of our offices, we every day put bookshelves and chairs so that everyone can read books, can also socialize, maintain social interactions. And above this, we are 2 times per week organizing also cognitive games, memory games, readings of different books. And those who wish can also come to our offices and have counseling with our social workers. So thank you. This would be brief.
Thank you so much, David. Brief, but as ever, very innovative. So you already are doing visual arts activities, library activities, and thank you very much for emphasizing the importance of personal protective equipment, of enforcing social distancing. That's always very important and hasn't come out yet. I'm now going to pass very briefly into France, but I'd like to acknowledge the contribution of a number of countries for this segment. From North America and Canada and the US, from the Caribbean, Trinidad and Tobago. From South America, we had Argentina, Brazil, and Uruguay. From Europe, we're having UK, Germany, Cyprus, Greece, Austria, and France, and further away from the Middle East, Iran and Israel. Again, if I haven't mentioned any of the countries, please do make yourself known in the chat line. I've just realized that Pakistan is with us as well. So now, please, Lorène Gilly, who is the Head of Public Affairs of France Alzheimer and Maladies Apparentées, the floor is yours. Thank you, Lorène, for being with us.
Thank you. Hello, everyone. Thank you. First of all, I would like to thank you again for this opportunity to present our activities, our main activities during this period, and especially the activities that will have a strong and persistent echo in our missions now and in our global advocacy. So first of all, of course, we are still amazed by the incredible mobilization of our 99 local branches on the French territory, a mobilization through a telephone helpline, psychological support, online support with different activities running online, such as physical activities, support groups for caregivers, and relaxation workshop also. Besides all of these actions and the mobilization of our volunteers, we created a specific show on our web radio, which continued to air during all the lockdown, and still has a current show running for specific questions regarding the pandemic. Also, we had specific demand during the lockdown from health professionals in the nursing homes to get specific trainings. So we created specific contents and specific trainings online to address these issues and their demands. And now we are trying to make this to develop this offer, and we are currently starting to open new conferences online on different subjects. What I wanted to say also, I wanted to speak, as it has already been said, about our advocacy and the fact that we had to raise the voices of people with dementia and their caregivers. So we are now participating in the current consultations of the government regarding the improvement of the health, the global health system, and on how to improve our global and collective answer to elderly people and to the issues at stake when talking about dependence. And it is now really important, as we had to, as the neurodegenerative plan, French plan, came to an end last year. It's really important for us now to raise the voices of people with dementia and their caregivers, so we don't forget the situation they went through during this pandemic. We have to make sure that these situations never happens again under any circumstances. And I wanted also to talk about the fact that we are trying to highlight the incredible mobilizations of different actors on the field. They imagined and developed activities that were improvements for support for people with dementia and their caregivers, and we have to remember these actions and to make sure that the politicians will take these wonderful mobilizations into account now. Thank you very much.
Lorène, thank you so much. As ever, bringing back the important point of how do we involve government, how we make sure that what we have seen is not going to happen again, how we integrate this into a national plan, how we ensure that there are answers for elderly people, for people who depend. Such important issues. So thank you so much for your example. I'll just draw your attention to the fact that there was an article published in the Telegraph in England today on those very topics to which ADI could contribute. We were delighted to even be asked, because vast majority of time is so hard to get governments to think global, to think about the fact that we should learn from each other and from these experiences. So now, very briefly, I'm going to pass to the Netherlands and to Anne de Boer, which I'm going to pronounce terribly. I'm so sorry, my Dutch is really, really bad. She is in the Advocacy and Public Affairs section of Alzheimer Nederland, one of our most innovative members, and also one of the members that innovates with the lightest of touches and grace. Anna, the floor is yours.
Thank you, Paola, and thank you, ADI, for organizing this webinar. Today I would like to share you one of the initiatives that actually our volunteers created in the Netherlands. It's the Alzheimer Cafe that we normally have. I think you can press the, yeah. So we have 48 regional chapters in the Netherlands, and they all organize 252 Alzheimer cafes. And the Alzheimer cafes are supportive for the caregivers and people with dementia. And it's a chance for them to gain information on a super accessible way. And they can meet with each other. And one thing that I also like of the Alzheimer cafes is that also healthcare professionals are welcome. And in this way, they can have a shared view of different obstacles that they have and understand the way of thinking of the other side, because sometimes there can be some friction between one side and the other. So this is a super nice way to meet with each other. But of course, all the meetings were canceled because of the coronavirus. And that's was a big influence on the caregivers and the people with dementia. And as also David from Slovenia shared with you, we also try to get all the experience of the caregivers to see what the impact is. And we saw that the lack of support for the people living at home was enormous, and the changes and all the new regulations were difficult to understand. And normally the Alzheimer Cafe is there to inform the people, but it was not possible anymore. So our volunteers searched for alternative ways to have contact with their visitors of the Alzheimer Cafe. Can you press? Yeah. So in the beginning, we were not sure, of course, how long this crisis was going to take. So we started with mailings, calls. We also have a support line for to ask questions, to share, and also to just if you have a lot of burden and you just want to talk and share what's happening and how heavy sometimes it can be. We did advertisements in the local newspapers with also the phone numbers of local support volunteers that can help and maybe think along. But when we realized, okay, it's going to take some time, and we would like the visitors also to meet with each other and not only with the organizers of the Alzheimer cafes, they decided to create online Alzheimer cafes. We help them in a way, but we try to let them free because they know best what their visitors wanted locally. So there were a lot of different types of Alzheimer cafes online. There were videos on YouTube, and you can press. And so I would like to say again that all the volunteers did this by themselves, which is super great. And they invited experts, and the topics were always very up to date. So the questions that were raised in the local areas were addressed in the online Alzheimer cafes. So, and the benefit of the YouTube version is that you can look at it whenever you want. So that was very nice. Then we had some online Alzheimer cafes through Microsoft Teams, and you can press. There it was the best. I think the best thing of this is that all the visitors can have contact with each other, like we can have now as well. So through the chat, you can ask questions. It's very interactive, and I think it's nice that if some question pops up at the moment, they can address it immediately. And also, this can also be recorded and look back whenever someone has time or whenever someone wants. And there were also some volunteers that even reached the television. You can press. So in the local areas, each area has a channel with some news that is happening close by. And there were some volunteers that managed to become like famous on their local television and to address the topics for that were important for people with dementia and their caregivers. So here's one example. And what we saw, you can press. It's very approachable to do it online. People can watch it at any time. And also when there's maybe an obstacle to go somewhere, or if you are still a bit ashamed of whatever, you can just give it a try because it's very approachable. It was a way to keep in contact with the visitors. And after the Corona crisis, we think it would be a good addition to the regular Alzheimer cafes, but we will never replace it because the physical contact and seeing each other and being in the same room to share experience is I think not replaceable online, but it would be a good addition to the regular ways of the Alzheimer cafes. In September, we're gonna try to open again the 252 Alzheimer cafes that we have. With all the social distancing rules and maybe in some new locations so we have more space. and to see if we can combine maybe with some streaming to see if how to continue now. So that was the initiative that I wanted to share with you. Thank you.
Thank you very much, Anna. So lovely to hear this, and also the fact that you're already thinking about what's going to happen next, which, as we explored in our third webinar, is not entirely clear because the situation may resume, may be hybrid, and this is why speaking about innovation in this context has been so nice. We hope that this has given a lot of inspiration to people, inspiration that will then be translated into practical activities. I'd really like to get into the Q&A, but we have a last but not least, Huali Wang, who is the Executive Vice President of Alzheimer's Disease Chinese, a Professor of Dementia Care and Research Center of the Institute of Mental Health in Peking University, is with us. You will all remember Huali kickstarted one of our very important webinars at the very beginning of COVID, one of the people to first speak about the importance of well-being both for people with dementia and for their carers during COVID-19. Well, it's a joy to have you with us. We know that yesterday you spoke at an event with 107,000 people. So we are very, very happy that you are with us today. The floor is yours.
Thank you, Paula. Hello, everyone. It's my great honor and a great pleasure to be here with you to share our practice of that dementia care service post-COVID pandemic. Although currently Beijing is we are still in strict quarantine regulation. First, I would like to share an ongoing dementia awareness campaign. Here are some snapshots, screenshots. This is a campaign that is currently ongoing this week because we are celebrating the 20th anniversary of Dementia Care Support Group in Beijing University Institute of Mental Health. This is the first dementia caregiver support group in China. So this year is the 20th anniversary. So as usually we celebrate this anniversary through like large event, like we have gathering, but now because we have to implement a social distancing policy, so we have to move everything online. So this year we have an innovative idea that we collaborate with GD Health. You know, GD company is the largest online sale company in China. Most people buy things from this website. So we collaborate with them, the health sector of this company. We created a Dementia Awareness Raising Week. So starting from Sunday, July the 12th to 17th, so until Friday this week, we will organize 6 sessions of public lectures. Here from the slide, you see that we have included 11 distinguished experts as the panelists. And here you can see some screenshots that are like live talk show. Yeah, Paula just mentioned that yesterday we had more than nearly 170,000 participants on this live talk show. We can see that this is one example that demonstrates the great potential of remote support and how we can make use of online resources to do public awareness raising campaign. So if we compare, next slide. If we compare the current online public education with the typical public education, we can find that actually this kind of online live talk show or public education program are quite efficient, and also that can achieve a large coverage of audience. If we take the typical format, we can see that we only like deliver brochures, we set up exhibition booths, but usually we can only deliver one topic for each session. But now if we organize online lectures, we can organize a series. Like this time we organize 6 topics just within 1 week. Then we cover more than 150,000. So we can see that this online format is an ideal format during the time after the COVID-19 pandemic. So I would say that such kind of online campaign might be a major or a common format in the next few years. And also with the development of new technology, I would suggest that we could consider making use of this technology to do public campaign. So next slide. In addition to such kind of online public education, actually in the past months, in China, we have like the technology of providing e-health service has been developed dramatically. We set up a memory clinic online, like we collaborate with GD Health. Here on the right column, you can find that these are the panel, the team members. All those team members, the first one is me, and the other 3 colleagues, they work from different hospitals. So using this kind of e-health service platform, doctors or a group of experts from different hospitals could connect with each other. And also we can build a virtual multidisciplinary team. Such kind of format is almost impossible in routine hospital practice. But if we move this service online, that is practical. So this can help us to improve the efficiency of organizing the MDT service. And also currently, several groups are trying to develop and calibrate the computerized test. So I'm sure that in the very near future, the standardized online cognitive screening would become the primary approach for us to support the early detection of cognitive decline. Next. Yeah, as for the caregiver support, actually, currently we still restrict the face-to-face meetings. So online caregiver support, as you, the experts from other countries, or the members here shared, that currently webinars or in China, WeChat groups have organized in many places. So all these WeChat groups, they can support each other, and the professionals are working with them as well. So we can help them to address their concerns. And also actually during this week, we also bring their concerns onto the live talk show so that other experts could give them suggestions and also address their difficulties. So currently this kind of online caregiver support, I would think that this would be more helpful to sustain the caregiver support in the future. Next one. But although we have foresee the great potential of online service, but we still cannot neglect the face-to-face support, especially in nursing home. So during this period, actually we collaborated with the nursing home to develop a type of normal motor cognitive training. From the picture here, you can find that a lot of old adults, they have to sit on a wheelchair. So that means they have great restriction in mobility. But within such kind of motor cognitive training, they could follow the instruction of the nursing home staff, and they try to exercise themselves. And also, because here we have to cover their faces, but actually their faces are presented in great pleasure. They show us their smile. They feel they are relaxed after even like 10 to 20 minutes slight motor cognitive training. So I would say that, of course, in the future, we have to try to develop online service, but we could not neglect the needs or demand for those people who are living in the nursing homes. We still need to support such kind of face-to-face rehabilitation activity. So therefore, I would like to summarize that currently we have seen a lot of opportunity to develop online services, either clinical service or online consultation or public education. But we also have the opportunity to develop a face-to-face rehabilitation. And also we have more opportunity that the nursing home staff could interact with the people living in the nursing homes. So I'm very glad that to share with our current practice. And I would consider that this might be in the future to be the ordinary support in after COVID-19 pandemic. So thank you very much, Paula, waiting for me and because I just finished my online public lectures. So thank you very much for giving me this opportunity. Yeah, thank you.
Thank you so much, Huali. Always great to hear you. Thank you for your tips on cognitive testing. And for those about mobility, having seen one of my neighbor actually deteriorate very rapidly because of lack of mobility, I've seen firsthand what it means to have those kind of issues. Now, just briefly, we are going to be over time, but I want to be able for the whole panelists to answer at least one question. I will try to use it very quickly. And in order to do that, I'm going to pick up some of the questions and tell you what's going to happen to them. There is a question about witches and in Africa and behavioral issues around that. We will pass that question to Petra and to our African group who has been working on this issue now for a couple of years. So they will be best placed at giving you an answer directly on that. There is also a very good question about how can we now do World Alzheimer's Month activity, considering the social distancing and difficulties that we're going to have. Well, we do have materials at ADI that we have developed this year, giving you ideas on how to do socially distanced activities. So the team will post online links now so that you can see where those materials are and have a inspiration around them yourself. But one particular question has come up for Huali, which is about what would you suggest is a good cognitive screening tool that people can use? Now, this is the million-dollar question, having studied it myself last year. I know it's not easy to answer, but Huali, I would really appreciate if you could try and attempt to answer that question directly in our Q&A answer. If that's not possible, the team will pick it up and then the participants will be informed of what you would suggest. But I know it's a difficult question to answer. The question I'd like the panel to answer is really interesting, is regarding behavioral changes. So the question came phrased in this manner: have you seen behavioral changes in people with dementia and in their carers during this period of COVID-19? Do you have any tips about how to cope with those in particular? So I will ask now all of our panelists. Maree, I see that you're still with us, so I'm going to ask you first, and then I'm going to go down the panel. Can you give us two very rapid thoughts about that particular question, please?
Indeed, Paola. Now, we've done some research in Australia around this, and one of the things that the research shows is that where people have been deprived of social contact and visits from relatives and loved ones, that their dementia has been declining more rapidly. And that is a real concern because these are not skills that people will necessarily be able to regain. So the balance between the right amount of stimulation is important, and that social contact with people that they love is absolutely fundamental to ensure their cognitive well-being and their physical health and well-being. So I'll leave it there. If you'd like me to expand on anything else, please say so.
I think that's great. I'll give the other panelists the chance to come in. Emily, you can speak from the point of view of people living with dementia. You must have seen quite a bit.
Oh, yes. Yeah. For me, is that because I'm a co-facilitator for Voices for Hope, I found that by bringing the Voices for Hope program sessions online, it really helps us, especially for person living with dementia, to be able to be engaged again and not that isolation issue is being minimized a bit because we get to see familiar faces, our friends again. Yeah, that's all for me.
Thank you so much. Really insightful. That and Rachel, do you have any insights from ADA?
For us, I think there was a person living with dementia that I actually, there was a decrease of social interaction for her. So she was at home. Her diet, you know, she started eating lesser and she started talking lesser. So the family was worried about that. So what we did was that we thought of, you know, she likes makeup, she likes to do makeup. So we started doing a session of Zoom where, you know, we invited people who are interested in doing makeup, the ladies, and they all come on, and then, you know, they teach me, you know, how to do a makeup. So that session, I think it was a very enjoyable session. Everyone was laughing, and, you know, they had a chance to put jewelries on themselves. You know, they were all dolled up. So, and ever since that session, their family actually said that the mom seems to be eating a little more, seems a little happier. So I think it's really about, you know, just trying anything, you know, anything that is of their interest. Yeah.
Lovely. Thank you so much. That was a good answer. Douglas, can I ask you to come quickly online with us?
Sure, thank you. And that's a great question. You know, I think what we are hearing is the social isolation really is affecting persons with dementia all across the disease category. You know, naturally people who are in the later stages of the disease and memory care units, but also people who are early and middle stages, maybe even more so, because they really are aware of the social isolation, and those living in communities, independent and assisted living, really are struggling, and it's really resulting in an increase in dementia-related behaviors, but also around things like nutrition. We're starting to hear that persons really are not eating and maintaining fluid intake like they have because they're not being able to dine and have activities with their friends.
Douglas, thanks so much for mentioning that. Actually, nutrition came up in another one of our webinars, and we thought we probably should get more in depth with this particular topic on one of the next webinars, because it has been raised pretty much all over the world. So thank you. Paola, would you like to quickly come on to this one, please?
Yes, thank you, Paola. I think the changing routines for the people with dementia, as well as the member of the family, generate a new situation to face and to learn, such angst and lack of patience and confusion. Wherever in our workshop with families and caregivers, the same problems are day by day sent like normally. I think that it's a point important.
Thank you. Füsun from Turkey, any tips from there?
Well, I can say one good news and one bad news. The bad news is that the caregivers who had learned how to live with their loved ones had trouble coping with this new situation with the pandemic. And so the anxiety level of the caregiver was so high that they could not help their loved ones efficiently in the beginning, and they needed more help than their loved ones. And of course, the social isolation and also being locked inside and not being able to take the regular walks outside that relieved the patients was also a negative issue on the patient, and so their decline got faster in time, and we had to witness our patients that we had close contact with. They got worse very quickly. And also the caregivers were helpless, really, in the situation. They couldn't explain what this was about, why they couldn't go out, why they should wear masks, what the social distance is about, and why they have to wash their hands so many times, and so on. This was the negative part. But the positive thing was that all this digitalization was learned by all generations. Digital world happened to be something that only the young people could use and depended on. But now everybody of all ages are waiting for the Zoom meetings. They're keeping track of the Twitter messages and Instagram posts and things. And they learned this technology. And also they realized that this technology helps them to overcome problems like time and location. For example, in Istanbul, 17 people live in the city. Can you imagine? It's like a country in one city, and the traffic is horrible. It's very difficult to reach a meeting, a seminar, and plus you cannot leave your patient at home and attend the meeting. But when it's Zoom, your patient can be lying next to you or can even participate in the meeting, and you can benefit from it. So this was the good news.
Füsun, thank you very much for highlighting some really important element. We heard also from India a similar story, that telemedicine works in cities of over 15 million people, because it's actually a much quicker way to deploy very scarce resources, psychiatrists and psychologists. Mm-hmm. Now, David, any insight from you?
Yes, we had similar findings that this lack of social contacts led to a decline, and also the ones that maintained social contacts with the family, and also our volunteers regularly called them and had conversations with persons with dementia, are showing signs of decline. They stopped talking. There looks like that they more surrendered to everything. They're not very, as active as before. And one of the reasons could be also that their daily routine completely changed. So in some cases, we have found out that those families that could maintain their daily routine and in a way adapted it to the new situation were more successful in maintaining the behavior of the person with dementia at a higher level. And at this point, I would add also something, because we all hear it and all use it, and it's about social distancing. We had a discussion here in Slovenia, and we stopped using the word of social distancing, but we are talking only about physical distance and social vicinity, because we must keep social contacts, but we also must keep some physical distance because of the transmission of virus. So, thank you.
Thank you so much, David. We received a message in the meantime from Fadun Doya, reminding us that in this crisis situation, doing online activity is not evident in certain localities. In African context, most of our elderly people are not used to technology, which I completely agree with. But then I hope, Fatu, that you may have found the example of David earlier of the library under the trees. This is one of those kind of activities that I can imagine being really taken on in Africa, where there is such a tradition of telling stories sitting under trees, which I have myself been on the receiving end with great joy. Can I also now ask, please, Lorène to come in from France, please?
Yes, well, we observed the same, and I'm not going to repeat. It's evident with the lack of interactions, isolation, lockdown. But what has maybe struck me a lot is the number of testimonies from caregivers talking about their feeling of culpability regarding the situations their loved ones were living, and the fact that we are gonna have to follow this this feeling and to try to answer their culpability on these situations.
Lorène, can I thank you a million? The issue of culpability, the sense of people incapacity to actually deal with things, not being able to deliver at the same level as before, has been brought up so many times. We really need to remind ourselves of how, for caregivers, this is a massive issue. Thank you so much. Anne from the Netherlands, any insight from you?
Two short things. I think the structure that follow for the people with dementia at home was super difficult for them, and especially it's difficult to fill your day with activities. So we made a list of 100 activities that you can do at home to give the people with dementia at home some tools. And the second thing that I want to add is that we're now collecting all the initiatives locally, and to make a book of 10 activities for the municipalities, so they can continue with the activities or with the initiatives, or start them if they didn't start yet, just to inspire. So that's what I wanted to add. Thank you.
And thank you so much. I fear this book is going to be in Dutch, otherwise I would ask you to share it with everybody.
Yes, it's in Dutch.
There are people here that do speak Dutch, so do share it anyway, because quite a lot of our members do speak your beautiful language. So now, can I ask Huali, last but not least, Huali, do you have any insight for us? You may also have thought in the meantime about cognitive tools that you want to share online officially, but otherwise not. You spoke to me at the very beginning of this about the issues relating to families, multi-generational families being locked down together for the first time. I remember us talking about it back in February, March. What is your reflection now?
Actually, I think that working with when the family is restricted of the home month, actually we have opportunities. Family could interact with the person at home more frequently than before. So I can see that more and more families are trying to build a better relationship with the people living with dementia. So that's an opportunity. The other is the disadvantage that the family may pay more attention to the difficulties that people have. So we have to help them to correct their idea or perception of the person's difficulties. So that's why this time we raise the awareness. During this campaign, we try to build a more positive value of dementia in the society. So it has generated very positive results. So that's why people are more feel that this series are more attractive than ever. So I would say that currently we are successful in building positive image of dementia in the society. Concerning the cognitive testing, yeah, of course, there's no absolute answer about which test is best. But I would still consider that every country would have the opportunity to find an optimal one. It might be simple, but it could be practical. So for example, in China, this afternoon, we just had a meeting and we determined that in the next few years, our government will implement the community-based screening for people living with dementia. And also this will be one of the indicators for healthy China 2030. Within this action, we will use 88. That's only 8 questions about the functional of the people. And also we will use brief version of CSID that has ever been used in the 1066 program. Because CSID has ever been used in our National Mental Health Disorder Survey. So we finally determined that we are going to use these two instruments for the first step screening for people who might be suspected of dementia. And then the people will be referred for clinical diagnosis of experts. So that's why I think that although we cannot find the best one, but we still could select one that might be appropriate for the real practice. Because currently in China, community doctors are very busy. So we have to select a simple one that's easy to use, and then they will provide more support, like practical support for the people. And the other point is that actually WHO, the West Pacific Regional Office of WHO, has developed a toolkit of community-based dementia care in low and middle income countries. You can find this toolkit from the WHO WIPRO website. And on this toolkit, actually we suggest that you can use 88, but this is not the only one. Actually, we only use one question to help people to screen. The question is, have you noticed any change in cognitive function, behavior problems, or functional ability of the individual? If this question is answered yes, then you can go and use 88 or other screening tests to do more screening. So if you feel that you are lack of cognitive screening instruments, you probably can choose only this question so that the families can give you a report about whether they have ever noticed changes. So that's my suggestion, that although there's no absolute answer for cognitive screening, but we can still find some solution to move forward, how we can help early detection of people have cognitive disorder. Thank you, Paola, and thank you, every members here.
Huali, this answer to this question, I think, opens a completely new chapter. I think we really need to think now, what are we going to do with this webinar? Because it has thrown open some really interesting things. We did have an inkling of this when we did the third webinar about future gazing, and Serge Gauthier and I were having a discussion about this point. I think we do need, as ADI, to acknowledge that the opening up of telemedicine as opening new venues for cognitive assessment. And we, as an organization, probably have to call, in a way, for a greater clarity in standardization of testing capacity. I think you have mentioned the excellent tool of WIPRO. WIPRO is the WHO Western Pacific Regional Office, which has developed the tool specifically for the Western Pacific area. And, you know, how are we going to learn the lessons for that for the rest of the region? That would be in itself an important question. You've also mentioned the use of the 1066 methodology. For those of you who do not know what 1066 is, please do go on the ADI website, where there is a lot of information around the 1066. But I think this has thrown for us a gauntlet that we as an organization need to help everybody arrive to a better cognitive screening and assessment, and spread awareness of what those instruments may be according to the regions. I would like to thank all of my panelists today. I think this has been an incredible panel, judging from the comments that are arriving online. Thank you so much, all of you. For questions that we may have not answered directly, we will try and pass them to you. A link to the webinar will be available soon. So everything in the webinar, slides, etc., will be quickly available very quickly. I remind all of you, if you're in a position to make a donation or to get others to make donations, please do. And I will thank you and remind you that World Alzheimer's Month is coming soon. There is a wealth of information on what kind of tools can you use to help us increase awareness around dementia globally. September is an important month for us. 1st of September is World Alzheimer's Day. We will be launching the World Alzheimer Report. We will let you know if there are other open public webinars on our usual channels, so that you can register if you are interested. And for now, I thank you very much. I ask for your forgiveness for us going over time, but as ever, this has been an incredible discussion. Thank you all for providing inspirations to everybody all over the world. And thank you from Finland and Panama for being there as well. I hadn't mentioned them. Bye-bye.